Good Wednesday afternoon. Thanks so much for watching THV 11 News at noon. I'm Michael Aaron. Meteorologist Scott Covert out in the weather garden enjoying another nice warm day. Scott, we hear the tornado sirens. It is just a test, everyone. Look at those blue skies.
Just a test. There is no threat in downtown Little Rock or anywhere across the national state other than quite a bit of sunshine and certainly quite a bit of humidity. Take a look here at your satellite radar composite. Now, we're not seeing any showers or thunderstorms as we speak. However, we do have a chance later this afternoon. Here's a look at your current temperatures. 83 warm degrees here in the capital city, warming up to 86 currently in Conway. Today we're looking at a high temperature of 88 degrees. Quite a bit of humidity though, so it's not going to feel comfortable at all. We do have a 30% chance of a few scattered showers or thunderstorms. I'll talk about the timing of that and who stands the best chance to see them coming up in your full forecast.
New at noon, Special Prosecutor Jeff Phillips will hold a press conference on Friday to announce his decision in the investigation of Michael Davis. Davis is the former Lonoke County deputy who shot and killed 17-year-old Hunter Brittain during a traffic stop in June. So this would be whether or not that former deputy would be charged. So stay with THV 11 and THV11.com for the very latest on that announcement. Little Rock has voted against Mayor Frank Scott Jr.'s Rebuild the Rock sales tax increase. 62% of voters said no to the penny tax that would have taken effect in January. The sales tax has been a big initiative for Mayor Scott. It would have brought in more revenue for Little Rock's parks, education, and the zoo, but the mayor says he is not giving up hope just yet. He released a statement overnight saying in part, "We'll keep fighting to rebuild the rock." So what comes next? We're going to have that answer tonight at 5 and 6. We continue to see some encouraging signs when it comes to COVID-19 in Arkansas, but there's some bad coming along with the good. It's now been a week since we've seen an increase in COVID-related hospitalizations. You see that downward trend there on the blue part of the graph. Right now, there are just under 1,200 Arkansans hospitalized with the virus, but the state has now had 5 straight days with at least 30 COVID-19 deaths. Our daily case numbers continue their gradual decline, though. The chart on your screen shows the progress we're making with our 14-day average, continuing that downward trend, just like hospitalizations. Right now, there are just more than 17,000 active cases in Arkansas, and get this, that's the lowest number that we've seen since the end of July. Governor Asa Hutchinson once again making it clear that he opposes President Joe Biden's vaccine requirement for businesses. He says federal requirements simply go too far. The governor said that he understood mandates for the military and federal employees and supports the ability to impose vaccine mandates in schools if needed. But he says an order on businesses just doesn't fit right now.
Now is not the time. We don't know what the future holds. We don't know whether there's going to be another variant come in, but I do support the authority of the state because we've obviously done that with many other types of communicable diseases in the schools that we require vaccinations on.
And while Governor Hutchinson supports the option for state requirements, he made clear that he will not propose vaccination mandates anytime soon. Several hospitals and businesses across the state are already making vaccination a condition of keeping a job, but there are 2 ways employees can be exempt from a vaccine requirement: disability or a religious belief. THV 11's Mercedes McKay explains why the religious exemption is raising some questions.
It's easy to provide documentation of a medical condition from a doctor or healthcare provider that would exempt an employee from having to get the vaccine. But experts say it's not that easy for religious beliefs.
You can't just say, I'm religious, or I object to the vaccine, I don't believe in the vaccine. You sort of need to provide more detail than that.
Local lawyer Amanda Orcutt says there's no hard and fast rule to what qualifies as a religious exemption. But the employee must prove their religious belief is, quote, sincerely held, and those beliefs do go against the vaccine.
So you have to make that link between the vaccine and the sincerely held religious belief. And if you can't, then employers could be within their right to deny the request.
Orchid says employers need to be clear if people are requesting religious exemptions. First, create a form for people to describe the nature of their religious belief and the reason they're requesting the exemption. Second, decide when additional documentation is required. Last, consider accommodations you'll allow for workers if their request is approved.
Remote work is possible. Masking and social distancing is possible. Those types of accommodations an employer might consider to be reasonable.
Back in mid-August, Conway Regional Health System announced a COVID-19 vaccine mandate for all employees, similar to the flu vaccine mandate they've had for years. But CEO Matt Troop says something was different this time around.
The total percentage of exemptions related to religious exemptions increased dramatically with the COVID vaccine relative to anything we've seen with the influenza vaccine.
A significant number of those exemptions, according to Troop, were related to a concern over fetal cells being used in the development of the vaccine.
It caused us to take a step back and ponder, do people really understand how ubiquitous the use of fetal cells is, either in the development or the testing of very common everyday medicines?
The hospital put out this form that employees requesting a religious exemption have to fill out, listing those common medications and asking the employer to acknowledge they won't take these medicines if they sign the form.
I respect people's opinions and I respect people's willingness if that's their sincerely held belief. We just got to make sure that they understand what that means.
Mercedes McKay, THV 11 News.
Troop says about 90% of his staff is vaccinated, partially vaccinated, or exempt. Next week, England will join the U.S. and start offering COVID-19 vaccines to kids younger than age 16. But the government is going a step further, allowing tweens to get the shot even if their parents disagree. They'll have to prove to a health official they're mature enough to make the decision. Hey, but some parents think that they should actually have the final word.
To give that choice to a child, really, when even developmentally they're not fully developed to make that decision. I'm just really surprised.
Here in the U.S., most states, including Arkansas, require minors to have their parents' permission to receive their COVID vaccine. But there are a handful, like Oregon and Alabama, that let kids decide for themselves. Right now to a consumer alert for you this afternoon. Authorities are warning about a scam targeting seniors. The scammers prey on people concerned about their health and Medicare coverage. Jessica Moore has what you need to know.
This is Becky, your patient advocate working closely with Medicare. Currently, Medicare is offering precautionary genetic cancer screening nationwide.
Seniors across the country are receiving robocalls that claim to be from Medicare.
If you do not act soon, then Medicare may label you as ineligible for coverage.
But it's a scam, according to the AARP. The fake calls have hit more than 60 million Americans.
These are sophisticated criminals.
Kathy Stokes is the director of fraud prevention programs at AARP.
In this process, the caller is asking for your Medicare number.
Scam artists may sell that Medicare number to other criminals or use it to file fraudulent claims. Authorities in Columbiana County, Ohio, say residents there are getting a different fake Medicare call.
They'll actually have the appropriate Medicare number and the name to go along with it, and they're telling them that they need a new card.
The Federal Trade Commission says scammers are often trying to collect personal information, like in this call.
I'm from Medicare. We're sending out the new cards, and I need to confirm your billing information to keep your coverage active.
Medicare never randomly calls looking for money or offering test kits.
Know that that's a scam because that's not how it works. Your doctor has to prescribe durable medical equipment or surgeries or test kits. And without that prescription, you can't get this stuff.
The Federal Trade Commission says if you receive a call like this, simply hang up. Jessica Moore, CBS News, New York.
So let's get to a THV 11 update just into our newsroom. This is an update in a Little Rock homicide that happened earlier this week. Police have identified the man shot and killed on Michael Drive early yesterday morning as 36-year-old Freddie Baker Jr. Investigators are now working to locate possible witnesses to find the person responsible for this. If you know anything about the deadly shooting, call Little Rock Police. Just about everyone is ready for fall, including farmers. But what will pumpkin patches and festivities look like after a very weird year? We find out right after the break. Scott.
Certainly feels like anything but fall. In fact, we're looking off towards the east. Gorgeous blue skies. It looks nice out there, but it certainly does not feel comfortable. How long does the heat and the humidity stick around? I've got those answers coming up in your full forecast right after this break.